So I just like to really first ground and root us into what is sexual health, right? And so that is the physical, mental, and the social well-being of an individual as it relates to their sexuality. So we all grow up in many communities, and definitely in the Black community, the Black church can be um, growing up in the Black church, right? There can be a framework around sexuality and what's appropriate. And so I believe that as parents, teachers, I believe it's part of the educational piece. And so many times that is left out. It is taboo and people refrain for teaching. So it starts early, and I think we have to start early enough. When you think about as puberty or at the adolescent, it's important that they understand their anatomy, their body parts. I start with that. Secondly, a woman's needs evolve. Her childbearing years, right? Her menopausal years, there is an evolution. And sexual and reproductive health are important components for a woman, no matter where she is in her lifespan. STI screening and testing is important for all. So if you are engaged in sexual activity, and many people, that's another educational thing, whether it's vaginal, whatever format, people have their views about what even is sex. So I'm a big proponent around health literacy, in education, and grounding people in education, because reproductive and sexual health are important, especially for women. Without it, without taking care of your reproductive and sexual health. And so when we talk about reproductive health, we're talking anything that pertains to that woman's reproductive health system. And there are issues, infections, injury that can impact a woman's reproductive health later in life. There are things that can cause infertility. There are things that can cause pain, chronic pain syndromes. So it can have a manifestation on our health. And so this leads me into talking about whole health, right? And so that's what I'm talking about, really paying attention. Most folks don't go to the doctor with a conversation or a consult around their sexual or reproductive health. Usually it's in the framework of something's wrong. Mm-hmm. Right? And so it's very important that we begin to think about reproductive sexual health. There is definitely room for continued education, because that education piece then leads us into proper screenings, which includes sexually transmitted infection screening. That is such an important component, because if we don't have that there's that lack of diagnosis. And if we can diagnose, we can intervene, we can treat. And if you have concerns about partners, there's also the opportunity to counsel on prevention.